Hello, family. Thank you for being here with me. This is Dr. Tina coming to you, Glam Doc Tina. If you haven't subscribed to my channel, I urge you to do so. Today, I have a short topic that I want us to talk about, and it's sepsis. Sepsis is something that most of us do not know about. And if you have heard about it, maybe you don't even know how to detect it. But today I'm going to show you because it's very critical. I have had a lot of patients being hospitalized for that, and it's very critical. And we need to detect it fast to save the life of many others because it's a critical issue and you can die from it immediately. So in order to prevent us from dying, these are some of the things you can do for your family members or you can do for your patients if you are a healthcare provider. What is sepsis? So sepsis is an infection that has gone through your bloodstream, and so it has all over gone through all parts of you, and it needs urgent care and immediate treatment. And so some of the symptoms that you can depict to show or see when somebody or your loved one go through that. Sometimes we just get cut and you think it's just a cut, and that cut can develop into sepsis. Sometimes we have chronic illnesses such as diabetes and other stuff. So the little sicknesses we get, it can deteriorate to that point. And so we have to master these symptoms so that when your family member or if you're a healthcare provider and your patient comes to you with some of these signs and symptoms, you'll be able to detect and send that person for immediate care. Mostly patients with sepsis end up in the hospital so that they can be treated with IV antibiotics and necessary things to do. And it needs immediate attention. And so if you delay, that person can die. I'm going through CDC website, and I will tell you that when we say sepsis, what does it mean at all? So before I go into sepsis, it says that sepsis, at least 1.7 million adults in America develop sepsis. That's very critical. That means a whole bunch of us can get sepsis. Nearly 270,000 Americans die as a result of sepsis. That's how serious it is. So we must take it seriously, especially this time that COVID-19 is in existence. We have to take note of these signs and symptoms because COVID-19 can be a viral infection which can end somebody into sepsis. So we have to note. 1 in 3 patients who dies in hospital has sepsis. So it shows that sepsis is very critical. What at all is sepsis? Sepsis is the body's extreme response to an infection. It is life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain reaction throughout your body. So this is a critical issue, and we must deal with it as soon as possible to prevent death or deteriorating situations. So, is sepsis contagious at all? One may ask. It says that you cannot spread sepsis to one another. However, an infection can lead to sepsis and you can spread some infections to other people, just like COVID-19. If you have COVID and it end up with sepsis, COVID is communicable. Somebody can get it and so you can transfer that to that. But sepsis in its sense cannot. So what at all causes sepsis? What at all? So infections can put you or somebody you love, a family member, into a risk for sepsis. For instance, maybe you stepped on a nail and it pinched through your feet, and sometimes most people do not pay attention, and maybe you might try to use other means to protect yourself or use other herbs or whatever to treat yourself, but then it can deteriorate to this extent of spreading through the whole body, especially if you have some sort of secondary issues such as diabetes. Is very critical. And so sepsis is very important. when you have infection or when you get a cut, you must pay attention to that because you can get sepsis through infections. Another way is germs get into a person's body. When you get germs, that is why we wash our hands before we eat. We wash our hands when we use the bathroom, because you can transfer germs through your mouth. Maybe you touch something on the surface and you pick food with it and you put it in your mouth. Definitely, you have eaten germs, and that can cause infection as well. However, if we do not stop these infections, then it will deteriorate or transfer to our whole body, which will create this sepsis we are talking about. Bacterial infections are most cases the cause of this sepsis. Sepsis can also be caused by virus as well, such as the COVID-19 we talked about, and also influenza. That is why when you have flu or COVID-19, we have to take care of you properly. Who is at risk? Who is at risk? So mostly the elderly are at risk. So if you are 65 and upwards, your family is 65 and upwards, you have to pay attention to them and make sure that care is given to them appropriate time, on time, and appropriately and accurately. People with chronic illnesses such as diabetes, lung disease, cancer, kidney disease, they are all prone to having sepsis. People with weakened immune systems, such as such as HIV, they are prone to sepsis because the immune system to fight infection is not that strong, and that is why it can end up with sepsis. People with recent severe illness or hospitalization, people that have been hospitalized one way or the other with illnesses for that time because they have been sick for a while, maybe the immune system is reduced or something like that, and so they are prone to having sepsis. Now, the critical part where I want you to take notes of is the signs and symptoms, because this is the only way you can detect to help save a life, to help save your loved one, to help save your family, to help save one another on the streets and everywhere. And so the signs and symptoms is very important. One, what are some of the signs and symptoms? High heart rate. You see that your heart rate begins to go up, 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 up. How do you detect that? Because we are at home, we don't do that. But when you go see your doctor and you have high heart rate, or your heart rate goes fast, low blood pressure. So let's say you have a high heart rate, your heart rate is fast, or let's say 120, 160, and your blood pressure is low, like in 90s, 60s, 70s, then it's a suspicion. Confusion and disorientation, most especially our elderly. When they develop infections like UTI and it has gotten bad and they enter into sepsis, you see they get so disoriented, they begin not to make sense in everything they say, they get confused, and those are some of the symptoms. Extreme pain or discomfort. So maybe they have extreme pain in their back or their lower abdomen, or symptoms like UTI symptoms, or pain in the place that they have the infection and discomfort. Then it's another sign. So you look at their urine and everything, and you see that maybe it looks cloudy and all that, and they are having all these confusions going on, their blood pressure is lower, then you have to take care of your patients. If you are a provider and you have all these symptoms, then you have to take a quick action to save your patients. Fever, shivering, feeling very cold. And so you see most people shiver and they have fever. Fever is one of the things that alert us that something is wrong. So let's say our heart rate is faster, low blood pressure, we get confused, getting pain maybe from urination. When we urinate, there's something going on. We don't feel good. It's this kind of discomfort, and feeling cold, shivering when the weather is not even cold. You have fever, then you must note that you have sepsis. Shortness of breath. You see the person cannot breathe. Those are some of the symptoms too. Clammy or sweaty skin. you know the weather is cold, but yet you are sweating. And that's another symptom of sepsis. So it's very critical to note these symptoms as a layman and as a provider as what? You must look out for each other. What should I do if there's a suspect of sepsis? If we are detecting sepsis, if we think that the symptoms that our loved one is having shows sepsis, what do we do? So sepsis is termed as a medical emergency because many people die from this. So you don't have to wait. So if you feel your loved ones are showing most of these symptoms, immediately you have to go to the ER. So you act fast. You have to take them to the hospital and they'll be admitted to take care of with a close monitoring, okay? So you have to get medical attention immediately, in person, anyhow you can. If you don't have access to hospital, you can talk to somebody on a telehealth and they can help you as well. It's very important to note these symptoms. I hope this short education about sepsis helps. I took most of these information from CDC. So if you want to read into detail the symptoms and other stuff, you can hop on to cdc.gov. It is www.cdc.gov/sepsis. It will give you more information. Stay safe, stay blessed. Remember to subscribe to my channel so that I'll be able to give you more education like this. Stay blessed. I love you. God bless you.